ANC President Cyril Ramaphosa has raised concerns on the surge of coronavirus cases, especially in the Northern Cape and the Free State provinces. He has called on the ANC leadership in the Northern Cape to prioritise bringing down the infections and protect the health system. Ramaphosa has appealed to the public to observe COVID-19 protocols. For more on this, we are now joined via Zoom by the MEC for Health spokesperson in the Free State, Mondli Mvimbi. Mondli, good afternoon and welcome to the show. As it stands currently, the Free State having the second highest number of active cases in the country. What has led to this?
Well, Aldrin, good afternoon and good afternoon to all your listeners, your viewers. The province, as according to the modelers, had already anticipated by around the 17th of April 2021 that we are likely to have a surge of cases. Remember, that period was a period of going into the Easter holidays, and around the 6th of May. We had already seen these cases climbing high, and coming from that Easter period, but also the lockdown level 1, alert level 1, people dropped the guard, and we started seeing an increasing number of cases that are coming from family clusters, places of entertainment. But fortunately for us, there was no, as you would know, ours started from a church cluster. But this time around, there was no evidence of any input from the churches. But as you would know, people move around, and the cases are increasing. But it's mainly due to dropping the guard. People in lockdown level 1, they've dropped the guard and they are not using as much of the non-pharmaceutical interventions as we continue to encourage them to. And the result of that is increasing number of cases that we see in funerals. We're also seeing them in the schools. So it's a mammoth task for us because there is no cure for COVID-19 as yet, but we continue to soldier on to make sure that we arrest the increase of cases by encouraging people to use the non-pharmaceutical interventions that are already established in the country.
Has the department thought about what the province's response should be to try and make sure that you contain the number of COVID-19 cases, considering as well that this evening we'll have the address from the president? What are your expectations?
Well, our expectations always for us in the Department of Health is always to make sure that we get the correct instruments that will discourage people from thinking that COVID-19 is gone. We need a tougher message out there that comes from the top that reminds people that non-pharmaceutical interventions are the correct way to go, and people's behavior is the only main tool that we know that will make sure that we survive this scourge. We have gone almost a year already with those non-pharmaceutical interventions, and now we are in the phase of vaccination. We're hoping that people are not going to get too sick not to be able to vaccinate, and that when their time to vaccinate comes, they would have been, not sick, so as for us to use that vaccination together with the non-pharmaceutical interventions going forward to continue fighting our cases down.
Do you expect any stricter measures, considering what you spoke about earlier on, how during the higher lockdown levels that you were able to contain these COVID-19 cases, considering now that the Free State itself is facing this third wave? Is stricter measures the answer, and is going up a level or two what could be the answer as well?
Well, you've been cutting a bit, but I think I get the gist of your question. For us, our expectation would be, it's the lockdown levels that were introduced previously were meant for us to be able to strengthen the healthcare system so that the healthcare systems are able to withstand any sort of challenges, any sort of pressures that they would be faced with should there be an increased number of people that are getting infected. Our observation so far is that in what is technically a third wave, we are not getting as high numbers as it was in the previous phases 1 and 2, and in the previous waves 1 and 2, and we think that a tougher message would not necessarily lead to us going back to those higher lockdown levels, 5, 4. It could be localized and targeted forms of lockdowns in the affected areas. So we think possibly the president might consider that. But it's all about us in our personal individual spaces, in our local organized spaces and district spaces, where we need to increase the levels of vigilance, to warn people, to take individual personal responsibility, to tell the next person, put on your mask, because those people in spaces that we've been with the MEC, Montseng and the officials in the province, whenever we go to those spaces and we found a person not using their masks, because normally they put them in their chin or they have it in their pocket, whenever we approach them, they respectively put it back. So that seems to us to be a behavior issue. And when people are held accountable by their own other next of kin, their own peers in the space, people are able to remember what they need to do, because others really they forget genuinely, but others it's a matter of complacency, and that complacency is brought down by a firm, consistent, good message of affirmation. You need to affirm each other. We need to hold each other accountable. We need to encourage each other to do the right thing all the time. They always say that integrity is what you do, is what you have when no one is watching. So we need not only be acting in manner of integrity when we are in public spaces, even now in our own families. We need to tell our people, watch them as they go out. Do they have their mask? Is their mask washed properly all the time? Do they wash their hands? How do they behave when they're in public, including ourselves? So we need to hold each other accountable and affirm each other all the time.
And just finally on the vaccine rollout, what we noticed earlier on in the past few weeks is the protest action that was taking place in Mangaung, for instance. How has that affected the vaccine rollout, and what's the status of your vaccine rollout just on a provincial level?
Well, so far, our target on this phase 2 of the rollout is we're targeting older persons of 60 and above, about 288,000 in the province. So far, we have registered 80,193, and we have vaccinated more than 44,000 of those. We continue to encourage everyone else to take part in this by encouraging elderly persons to be registered, to help them to register, because not all of them have the gadgets to smartphones and other gadgets to register. So we need to, about 10 grannies or older persons that you can help to register. So we need to go out there to help them to register. But indeed, we're badly affected by the shutdown, especially the one in Mangaung. The one we had in last week in Harrismith did not affect any of our healthcare facilities. It did not also affect any of our healthcare programs. But we continued to warn those in Mangaung not to repeat what they did, because we had to deal with very difficult things. Our vaccination campaign had to be stopped because some people were targeting healthcare facilities, they were targeting health personnel, they were targeting even the vaccine itself. So we had to act cautiously to pull back. And when the shutdown was stopped, we were able then to try and recover. And we see a lot of people coming into our vaccine site, even those that are not registered. They come to the vaccine site, and we try and help them. We do not encourage those people just to walk in. We want them registered so that we are able to deal with social distancing. We're able to deal with the potential to avoid the potential for people getting infected in our own vaccine sites. So we want them registered so that when they come, we're able to help them swiftly. And a lot of testimonies that we've heard so far are that our waiting time is very short in the vaccine in the vaccine sites. So those are encouraging effects. And we think, in any other situation, because the other observation that I must just make is that in the shutdowns that we have seen, people in political activity don't use masks, they don't keep social distancing. And after those activities, we see cases increasing. So they need to know that when they act irresponsibly by not using these non-pharmaceutical interventions, the ultimate and negative effect will be that they are going to get sick. So you have a right to participate in political activity or public gathering in terms of the limits. But please do it cautiously and make sure that you observe the non-pharmaceutical interventions all the time so that whilst you have addressed your political issues, you don't get sick and don't benefit from the outcome of those political interventions that would have been made.
Mondli Mvimbi, thank you so much for your time, the spokesperson of the Health MEC in the Free State.